What's going on, guys? It's Jimmy here with your second stimulus check update. And the health of President Donald Trump is of national concern today among the American people of not only his health, but if it might delay the second stimulus check and also possibly the 2020 election. The president is already on day 4 of his positive diagnosis of the virus, and day 8 is when UK Prime Minister Boris Johnson, when he had the virus, he was moved to the ICU on day 8. The president is now on day 4, and we're already starting to see a lot of conflicting reports from his own doctors, and some people are questioning if they're trying to show us the sunny side of everything that's going on with the president. There's questions on if President Donald Trump is sicker than his doctors are saying with his new treatment regimen, and also getting now dexamethasone, which is typically used in critically ill patients that have the virus. His blood oxygen level also dropped at least twice, at least from what they have told us, and he has also been on oxygen, but yet the doctors continue to tell us that he's doing really well. It's a lot of conflicting information. Let me show you.
The course of his illness, the president has experienced 2 episodes of transient drops in his oxygen saturation. We debated the reasons for this and whether we'd even intervene. It was a determination of the team, based predominantly on the timeline from the initial diagnosis, that we initiate dexamethasone.
Regarding his clinical status, the patient continues to improve. He has remained without fever since Friday morning. His vital signs are stable. From a pulmonary standpoint, he remains on room air this morning and is not complaining of shortness of breath or other significant respiratory symptoms. He's ambulating himself, walking around the White House Medical Unit without limitation or disability. Our continued monitoring of his cardiac, liver, and kidney function demonstrates continued normal findings or improving findings.
The president yesterday evening completed his second dose of remdesivir. He's tolerated that infusion well. We've been monitoring for any potential side effects, and he has had none that we can tell. His liver and kidney function have remained normal, and we continue to plan to use a 5-day course of remdesivir. In response to transient low oxygen levels, as Dr. Conley has discussed, we did initiate dexamethasone therapy, and he received his first dose of that yesterday, and our plan is to continue that for the time being. Today he feels well. He's been up and around. Our plan for today is to have him to eat and drink, be up out of bed as much as possible, to be mobile, and if he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House, where he can continue his treatment course.
Why were you so reluctant until today to disclose that the president had been administered oxygen?
It's a good question.
Thank you.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. Didn't want to give any information that might steer the course of illness in another direction. And in doing so, it came off that we were trying to hide something. It wasn't necessarily true. So here I have it. He is the fact of the matter is that he's doing really well.
So you just seen it there. The doctors are trying to remain upbeat while also giving the American people and the American public the negative information about what's actually going on with him, but they're trying to basically sugarcoat it, is what it seems like. As you can see here, before walking away, Conley said the president had a high fever and a blood oxygen level below 94% on Friday during another episode on Saturday. He was evasive about the timing, but it was over the course of the day. Yeah, yesterday morning, he said. And when asked whether Trump's level had dropped below 90%, we don't have any recordings on that, but he revealed that Trump was given a dose of the steroid dexamethasone in response, in addition to at least 2 doses of remdesivir also now in addition, and oxygen. Now, dexamethasone, as I said previously, is typically reserved for only critically ill cases of the virus, and they're already giving it to the president. Do you think it's a precaution, or do you think he's already showing signs of worse symptoms? Now, if you have a 401k or any money in the stock market, we're likely to see some pretty bad drops here starting on Monday because any uncertainty that the market typically hasn't predicted generally means that the markets will produce losses, and in some cases, severe losses, as this is pretty much national news, especially happening right before the election. I actually had a brand new video from President Donald Trump standing at the Walter Reed Medical Center that he just published about 15 minutes ago, but it actually appears that Twitter has completely crashed and is completely inaccessible, at least at this point of filming. I will bring you that in an upcoming episode or an upcoming video, but a lot of you guys commented down below in the comments when I showed you the president's last speech that he gave that a lot of you thought he looked pale and didn't look like his normal self. Let me know your thoughts down below in the comments, but I'm not sure. It's really weird that we're getting a lot of conflicting information. At one point, the doctors are telling you that he's really good and he could be discharged tomorrow, which I personally don't think they're going to discharge the president tomorrow under any circumstances. But they're saying, that he's doing really good. But then they're saying he had oxygen. He's getting this new steroid treatment, dexamethasone, which is for critically ill patients with the virus. He's been on remdesivir. He's been given oxygen. His blood oxygen level has dropped to concerning levels. I don't know what to think at this point because we're seeing two different sets of information. All I know is that my prayers go out to him and I wish him a speedy recovery. I personally think that he's doing a little bit worse than they want to tell the public because they're telling us his symptoms, but then they're trying to say that he's doing really well. Let me know your thoughts down below in the comments. President Donald Trump is also reportedly furious at White House Chief of Staff Mark Meadows, who is also the other Republican negotiator along with Treasury Secretary Steve Mnuchin. And apparently Mark Meadows seems to be a source of information leak from the White House regarding President Donald Trump's real status. As you can see here, President Donald Trump is furious with White House Chief of Staff Mark Meadows after top West Wing officials contradicted the White House physician's assessment on Saturday of the president's health. Mark Meadows is now widely known inside the White House to be the unnamed source who spoke to reporters following the medical briefing on Saturday. And Mark Meadows offered a more dire assessment than the Navy Dr. Sean Connolly had given shortly before. That report was initially given to a pool of reporters attributed to an official familiar with the president's condition. Later, the Associated Press and the New York Times identified that official as Mark Meadows. Mark Meadows said the president's vitals over the last 24 hours were very concerning, and the next 48 hours will be critical in terms of his care. We are still not on a clear path to recovery. A separate White House official now officially confirmed Trump is unhappy with Mark Meadows as the chief of staff, is now viewed by Trump advisors as having damaged the credibility of the current medical briefings on the president's bout with this virus. Democrat and Speaker of the House Nancy Pelosi, basically the Democratic leader during the stimulus check negotiations, remains positive that a stimulus check deal is very close, and this is basically the first time that she said that a deal is on the horizon and pretty much imminent, but now says that there's delays from the Republicans because the president has the virus. Nancy Pelosi also suggested on Friday that President Trump's positive diagnosis of the virus could change the dynamic of the stimulus check talks and help speed up an agreement in new rounds of economic relief. Nancy Pelosi asked airlines on Friday to hold off on impending furloughs of tens of thousands of workers pending a deal. United and American, the major carriers that have threatened furloughs, have said they can reverse them if there is a deal to extend payroll support to the industry that just expired, but that Congress must act fast. Nancy Pelosi says, "What I said to airline executives in a public statement is, don't fire people. You know that relief is on the way, and it will be retroactive, so let's keep them employed." In the last 48 hours or so, the Democrats tried to start and pass a standalone stimulus bill for the airlines, but it was blocked by Republicans. So that means if they do want to get stimulus out to airlines to prevent tens of thousands of people from being laid off, they're going to have to do it through a larger stimulus package, which will include the stimulus checks of $1,200 and $500 checks for dependents. Also, an unemployment extension update somewhere between $400 to $600 per week. The Republicans want $400 per week, and the Democrats want $600 per week. Both sides also have money in there for mortgage assistance and rental assistance to help you pay your mortgage or rent if you are struggling right now. Details of that are still yet to be released and likely will be released when they actually pass a package and they actually go to enforce that. But it's very likely that you could receive a stimulus check, possibly unemployment if you're on unemployment, 26 million people are, and also a check for mortgage and rental assistance. That's with the stimulus package if they can come to an agreement. Both Nancy Pelosi from the Democrats and Treasury Secretary Steven Mnuchin from the Republicans have said that they are closer than ever, and they're only about $300 billion, only $300 billion away from an agreement. But $300 billion is actually pretty small. It's only like 15% of the actual stimulus package. They're only 15% of the way. They've basically agreed on 85% right now. And it'll be interesting to see what happens in the next 48 hours if they can come to that agreement with the president's health possibly declining as he gets closer to that day 8 where Boris Johnson, the UK Prime Minister, had to move to the ICU and his condition significantly worsened. President Trump tweeted out yesterday to just get it done regarding the stimulus package while he was in the hospital. So the president remains a big supporter of the stimulus package and the stimulus check. And if they can't pass the stimulus package through an agreement, which I personally think they can. I mean, they're very close. We're just talking about tweaking a few numbers here and there. And if they can't, then he may have to pass the stimulus check through a presidential executive order. But we really want to have the agreement because it has, all those other things, the mortgage and the rental assistance, the money for schools, the unemployment money. I mean, there's a lot more help in there than just if the president passes a check through the presidential executive order. Also, I need to mention that at least 24 states are now seeing increases in the virus, and we're only seeing 3 states seeing a reduction in cases of the virus on a daily basis, with the other states seeing about the same levels. We're seeing a typically rise in cases across the United States. New York City is also now seeing another spike of the virus, and they're actually closing down some schools in some areas. Dr. Tom Frieden, the former director of the U.S. Centers for Disease Control, the CDC, and prevention under Obama, warned on Twitter that New York City is on the edge of a precipice, and we're seeing extensive ongoing spread in religious communities, and there's a high risk of the new virus resurgence, even in areas that were hit hard previously in the spring. So my advice is it's better to be safe than sorry. Try to social distance, try to wear your mask. Why not just be safe instead of possibly be sorry later on? That's just my thoughts. You guys can let me know your thoughts down below. I remember the first time I had to wear a mask when I went out to the grocery store, and the first time I was just like, oh man, this is terrible. This sucks. We're gonna have to do this. But honestly, as the days and weeks went by and I just got more comfortable with it, then it really wasn't a big deal. I actually have asthma. I've had it since I was like a teenager. I don't remember having it as a young boy, but I've had asthma for over 20 years now. The masks don't really bother me that much. I mean, of course, it's not great. I'm not happy to wear it, but I wear it because I don't want to get my son sick. I don't want to get my parents sick who are in their 70s, and I just would rather just not get it. I mean, you guys can let me know your thoughts down below in the comments, but as Baby Yoda says over there, stay safe. It's better to be safe than sorry. Also, don't forget to give this video a thumbs up and subscribe down below if you haven't yet. This way you won't miss out on second stimulus check and related news updates. I will keep you guys updated as more information comes out. We have videos going live at 10 a.m., 3 p.m., and 8 p.m. Eastern Standard Time. I'll keep you guys updated with the president's condition and also what is going on with the second stimulus check. You can click on this video to watch my newest stimulus check video next. And this video teaches you how to start a business selling products on Amazon FBA. I have students that have replaced their entire 9-to-5 income by selling products on Amazon, and I teach them how to do that. Click on one of those videos to watch them next. Thanks, and I will see you in the next video.